Howdy, everybody. Having a great evening so far? Yeah. I am Dr. Jonathan Chen. This is not a costume. This is just what you have to wear in the hospital. You want a scrub shirt so you don't get blood or other bodily fluids on you in the hospital. I do also teach at the university, and so in a classroom environment like this, I do find it's helpful to kind of, straighten up and try to be a little bit more presentable in front of people, and that way you can actually get on with the lesson a little bit more effectively. Y'all ready to learn? The ABCs of emergency resuscitation. Airway. If you find an unconscious patient, you have to make sure they have a patent airway. Don't stick this in your ear, but nobody ever said anything about the nose. Might be a good time for a disclaimer about now. Do not attempt to do this at home, kids. No matter what you see tonight, I promise you nothing dangerous is actually happening. I would not be that stupid. I'm literally a trained professional, a licensed physician and surgeon. If you think about it, does it really look like it's jammed in my brain right now?
Yeah.
It does. And if you ever had a proper COVID test done before, this should not be that strange. This is jammed in my skull. Could you thoroughly examine that, confirm for everybody's no help here, jeez. This is not a magic trick. This is just human anatomy. Cut away your head. Enters the nose. It is deep in your skull. It's just there's a very large nasal cavity there. Imagine, what if we take a small foreign object, toss it into somebody's mouth, goes to the back of their throat. They inhale it down the wrong tube. It's stuck into their upper airway. It could get caught right here behind your thyroid cartilage. That would be your Adam's apple. If you feel your Adam's apple, that is your thyroid cartilage. If that happens, you actually need to slice a hole here through the cricothyroid ligament to create a surgical airway to recover the breathing. For your education and entertainment tonight, I'm prepared to deliberately choke myself and demonstrate this technique. I do have a life-saving hole in here, so it won't be complete obstruction. Okay, I gotta lube this up a little bit. Floss kids too. I'm lubing it up. Same habit. We still have mold. It's okay. Surgical airway. Standard technique. B is for breathing. Sometimes patients will accumulate a pleural effusion, a fluid pocket around their lungs. They can't breathe properly. So what do? Thoracentesis needle. You stab a hole into the patient's back, allowing the fluid to drain so they can breathe properly again. I don't actually have fluid in my lungs, so that wouldn't make sense. So I'm just going to demonstrate the skin penetration technique. I promise you nothing dangerous is happening. This is difficult. Skin is very difficult to penetrate. Its skin is actually very strong. You can't tear it. You need a very sharp scalpel or a very sharp needle to be able to penetrate that through.
That's scary.
When you understand the anatomy, you avoid any of the neurovascular bundles, preventing any permanent or serious injury from happening. Hey, how are you going to make it through medical school? Oh man, this is jam tight. Here we go, here we go. Gentle traction until you can finally pass through. Of course, it is dangerous to have a sharp needle leaving behind the patient. Guide wire technique. You use a blunt guide wire and you follow the needle, yeah? I'm not making this up. This is just standard techniques. Follow the needle with the guide wire. Now you have the tract maintained, and now it's safe to remove the needle. You don't have to worry about any other kind of more permanent injuries that could happen at that point. All right, nobody panic. Nobody panic! Is there a doctor in the house? Is there a second doctor in the house? There is. There actually was somewhere. You know what? Sorry. You're just going to have to. Could you just grab the end of that wire there and just pull it straight very gently? Come on. C is for circulation. Maintain adequate blood pressure. Stop the active bleeding so people can perfuse their vital organs. The ABCs of emergency resuscitation. It is not magic, folks. It's medicine. Do not try this at home. Thank you all. I'm Dr. Don.